Alright, thank you so much for joining my channel. My name is Mr. Jake. Today we are going to study OET reading part C. This is the first time we are about to touch the part C, and if you're new on this channel, I have many video recordings on part A and B. Kindly look for them and watch. This is going to help you tremendously. This channel is designed for nurses and midwives and other healthcare professionals who have the intention to travel outside their countries, practice, and develop their career. So if you have this ambition, this is the right place for you. You need to write these exams and pass. So I will not waste time. Let's go to the quiet room and start our reading test. Alright, so ladies and gentlemen, this time around we're going to do part C reading test. And in part C reading test we have text 1, and we have also text 2. Okay, so in each text you may have like different paragraphs. So you may have paragraph 1, paragraph 2, and paragraph 3, and you may use these 3 paragraphs to answer 4 questions. So if you are going to answer 4 questions, that means one paragraph can contain 2 answers. Okay, so don't be surprised about that. Alright, so we are going to answer 4 questions under text 1. We have question number 7 to 10. Okay, so let's try it. You read the question, you go to the paragraph, then you come back to the answers. Question 7. The writer suggests that the potential for harm from asbestos is increased by. So the most important thing here is looking for potential for harm from asbestos. Okay, so also try to analyze your questions carefully. If you're talking about potential for something, it's about you seeing the thing as something that is likely to occur, or something that is linked to something, or something that is associated with something. Okay. Alright, so first paragraph. Asbestos is a naturally occurring mineral that has been linked to human lung disease. It has been used in a huge number of products due to its high tensile strength, relative resistance to acid and temperature, and its varying textures and degrees of fusibility. It does not evaporate, dissolve, burn, or undergo significant reactions with other chemicals. Because of the widespread use of asbestos, its fibers are ubiquitous in the environment. So there's a full stop here, and I'm just going to pause because I have seen a word like because. Okay, so if you are reading a paragraph or you're looking for an answer and you see such words like because, they are trying to define something for you. Okay, or it is more likely to introduce the answer for you. So you have to pause, think about what you've read, and if you don't get the answer, you have the right to proceed. Okay, so now what are we looking for? A potential harm, okay, from asbestos. And now I can see something like occurring minerals that has been linked, okay, to human lung disease. So lung disease is the harm or disease, and linked is the potential. So this is self-explanatory. Asbestos is a naturally, so we are linking this asbestos, all right, to human lung disease. Now we are going to look for some common words here. We can see that here they said it has been used in a huge number of products. So it means it is very common or very useful, okay, in many products. And when you look at it carefully, they end up to explain asbestos, their properties, okay. And finally they said because of the widespread use of asbestos. There's comma here. It is very deliberate. Okay, so this comma means they are going to start something new, or they are going to introduce some new idea. Okay, and here they have its fiber are ubiquitous in the environment. So if I were you as a candidate, I will just pause, go to my questions and answers, then come back again. Alright, so based on what we just read, we are going to look at the options that we have, whether we get an answer and move on and save some time. So we have question number 7. Question number 7, option A, a change in the method of manufacture. based on what we've read so far, are we emphasizing on change in the method of manufacture? I think that is not given. Then B, the way it reacts with other substances. I think they stated it clearly that it does not really react with other substances. Then C, the fact that it is used so extensively. This information is in the text so far, or the paragraph that we've read, because it has widespread of usage. Okay, it is used in a huge number of products. Then D, its presence in recently constructed buildings. I think this is quite opposite. So we go to the text and finalize it. So we understand this sentence: building insulation materials manufactured since 1975 should no longer contain asbestos. So this is very clear for text D, the option D, that recent materials. Okay, if they say since, it is explaining time. It means from 1975 to this time, building materials, okay, no longer contain asbestos. So it means the recent buildings don't have it. Therefore, the best option we have is what? In a huge number of products, or the widespread use of asbestos. So that is the reason why we are linking it to lung disease. Alright, so question number 8. The word ubiquitous in paragraph 1 suggests that asbestos fibers. So let's go to the paragraph. Alright, so this is my trick. If you're looking for a certain word like ubiquitous, don't just start right behind it and read. Okay, you may not get the answer right. The best thing to do is to start from where the sentence starts. Okay, so the sentence starts from here above. Because of the widespread use of asbestos, its fibers are ubiquitous. So what are they saying? Because of what? The widespread use of asbestos. So if it's widespread use, it means it is very common. Okay, so its fibers are ubiquitous in the environment. It means what? You take this one out. It means because it is widespread use of asbestos, its fibers are common in the environment. So if you put it that way, you may get the answer right. So very common, which means what? They are in everywhere in the environment. They didn't specify, so which means everywhere in the environment. So the options, we have option A, can be found everywhere. B, may last for a long time. Does it explain it that way? And C, have an unchanging nature. Did they go further to explain it that way? And D, are a natural substance. Is that what they mean by the word ubiquitous? So the best answer is what? Can be found everywhere. Option A. Question number 9. The case study of the 67-year-old man is given to show that, so it's not the time they will guide you to go to the right text, okay, or the paragraph. However, there are certain keywords that must help you. Here we have 67-year-old man. So if you see this one in the paragraph, rush there and read. Alright, so now we can see 67-year-old. So we rush to this text or paragraph, okay? Therefore, without wasting much time, let's move on. One of the 3 types of asbestos-related disease is asbestosis, a process of lung tissue scarring caused by asbestos fibers. The symptoms of asbestosis usually include slowly progressing shortness of breath and cough, often 20 to 40 years after exposure. So there's a full stop here. If you think about it carefully, the implication here is that it is slow, okay? The cause is, they've stated here, slowly progressing, okay? So we know the nature of asbestosis. That is the disease. All right. Now we can move on. Breathlessness advances throughout the disease even without further asbestos inhalation. This fact is highlighted in the case of a 67-year-old retired plumber. So they are saying these symptoms, okay, it is highlighted in this person's condition. He was on Ramipro to treat his hypertension and developed a persistent dry cough, which his doctor presumed to be an ACE inhibitor induced cough. The Ramipro was changed to Losartan. The patient had never smoked and did not have a history of asthma or COPD. So they are telling you the patient did not cause any deliberate damage to the lung, okay? The lifestyle did not cause any damage to the lung. So they don't know why the patient should suffer such symptoms. His cough worsened and he complained of breathlessness on exertion. In view of his history and the fact that he was a non-smoker, he was referred for a chest x-ray and to the local respiratory physician. His doctor was surprised to learn that the patient had asbestosis. Diagnosed by a high-resolution CT scan, the patient then began local proceedings to claim compensation as he had worked in a dockyard 25 years previously, during which time he was exposed to asbestosis. So when you think of it carefully, what they are trying to tell you is that if you even explain the first sentence, okay, that the disease can occur slowly, between often, okay, 20 to 40 years after exposure, which means when they get exposure to asbestos, the disease may develop, which is asbestosis, for a very long time. So even your doctor may put you on a different medication and would think that that is the side effect of the medication, but not knowing there's something else unless you get an expert to diagnose you. Okay? So my impression is that if I were you, immediately I read such text, my impression is that the disease occurs slowly after exposure. So let's go to the options. Question number nine. The case study of the 67-year-old man is given to show that A. Smoking is unrelated to a diagnosis of asbestosis. This is not the main reason we read. We learned something from the 67-year-old man. Then B. Doctors should be able to diagnose asbestosis earlier. This is not the main reason, okay? They are not pointing it on doctors. Then C. The time from exposure to disease may cause delayed diagnosis. Okay, so if you look at it from 20 to 40 years, so that is the time from exposure. Okay, and look at the time the man suffered asbestosis, the disease itself, and so it may cause delay because even the first doctor could not say they put him on certain medications until an expert came in. So that is delayed diagnosis. Then D. Patients must provide full employment history details to their doctors. Listen, this thing can confuse you. Even when you go to a GP, your history between 20 to 40 years ago, you may not remember, okay? And that alone cannot justify your condition after 40 years. So it will be hard for GP for you to provide such information for you to get an accurate diagnosis. So this will not really make sense. And the best thing that is explaining, or the best option that is explaining the text, is the time from exposure, C. Alright, so question number 10. In the third paragraph, so it is guiding you where to go in the third paragraph. Don't lose your way. Now, the writer highlights the disagreement about. So we are going to look for disagreement, okay, and opposing ideas, or an argument or debate, or conflicted ideas, okay. So this is the main reason or the main task here. So sometimes in examination you need to be more skillful to get your answers right and save time. So I would say that when you look at the number 10, you can see that we are emphasizing on what disagreement about something, okay? So just look for any possible word that looks like a disagreement or that can replace disagreement. Then pick your answer from there. That is much better. So now I just feel like saving time in my examination, okay? I feel like I've wasted so much time for the above questions. Therefore, the last question, I can apply these skills, okay? We are learning how to score higher and better. So what we do is what? Look for any other word for disagreement in the text or the paragraph. So we go straight. So I can see debate. So debate is in the form of what? Argument or disagreement or challenge or something like that, an opposing idea. Therefore, I will read the sentence just above it. I will not just start from here. Always start from the sentence where the sentence begins, okay? So now let's read. Although the Occupational Safety and Health Administration has a standard for workplace exposure to asbestos, which is what? 0.2 fibers per millimeter of air, there is debate over what constitutes a safe level of exposure. So what is the disagreement? It's about what constitutes a safe level of exposure. So let's go to the option. So we are talking about asbestos fibers, and we are looking for what constitutes a safe level of asbestos fibers. Okay, so don't confuse yourself. Now look at option A. We have the relative safety of the two types of asbestos fibers. Are we focusing on two types, the relative safety of the two types? We are talking about a safe level. Then B, the impact of types of fibers on disease development. Are you focusing on disease development, the impact of the types of fibers? No. Then C, the results of studies into the levels of risks of fiber types. Are we focusing on the results of studies into the levels of risks of fiber types? It's like this is not really explaining anything for me now. Then D, the degree of contact with asbestos fibers considered harmful. So if we talk about degree of contact, is about level of exposure. So exposure, contact, degree, level. So that is stated clearly at where we found the answer, where there's debate. Okay, and they're talking about the level that is considered safe. Okay, so if you look at it carefully over here, with asbestos fibers considered harmful. Okay, so if it's the degree of contact that is considered harmful, in other words, they are trying to say the level of exposure that is considered to be safe. All right, guys, I guess you had the answers right, and also you understand what I've done right now. We have more to present or to study, so always try and catch up with me. Let's study and pass our exams. My name is Mr. J. Thank you. Bye bye.